Hello, Mr. Robinson. How are you? My name is Blessing. I'm going to be your nurse today, okay? The doctor has ordered that we draw a CBC, we draw a lab. I'm going to be drawing some blood from your arm, okay? Alright, so first thing I'm going to do, can you tell me your name and your date of birth? Okay, and then the patient tells me, I'm going to verify on the arm, okay? So before I walked in, I looked at the orders, make sure that the physician has ordered that we draw the blood and what kind of blood that we're drawing. And then I'll come in with my supplies. Okay, now I do have my supplies. Usually for the purpose of this demonstration, we're going to be using this arm instead of the bed. Okay, so this is the patient's arm. Now I do have my supplies. So the first thing I'm going to do is to get my supplies out. Usually we might not have much room, so I don't want to carry the whole bag thing in here while I'm drawing the blood because it might be in the way. So we're drawing a CBC, so I'm just going to get the things that I need. I'm going to need a band-aid to tape the site once I finish drawing the blood. I'm going to need alcohol wipes to wipe the area to prevent infection. And then I'm going to need okay, this is really a very nice one. This is a 23 gauge. It has the Vacutainer in it. Okay, and then I'm gonna need a tourniquet, and then I also have a tape. Okay, and then I'm gonna have my tube. I'm gonna have a purple top for a CBC because we're drawing a CBC. Okay, and that's all I need. Then I'm just gonna put this away. That way I have some room to work. Okay. Once I put this away, the next thing I'm gonna do is going to wash my hands. Okay, so I'm gonna go over here. I'm gonna wash my hands. Wash my hand really good. Make sure I get all the creases and all that. You know, rub between my fingers and everywhere. Okay. All right. Doing that. And then while I'm doing that, I can be talking to my patient. You know, so how's your day going so far? You doing okay? Oh, great, great, great. Okay. All right. Hopefully the doctor should be in here very pretty soon. They'll make rounds like sometime in the mornings, you know, before noon. Yes, yes. Dr. Robinson should be here. Okay. All right. And then I'm going to clean my hand real well. Okay. Once I clean my hand real well. Okay. Clean my hand real well. Okay. All right. I'm gonna get my gloves on. Okay, once I have my gloves on, okay, first thing I'm gonna do is I'm gonna look for a position of the arm real well. Then I'm gonna try to look for a vein. Okay, just take a few seconds, look for a vein. Okay, I see a very good vein here. So I'm going to put my tourniquet 2 to 4 inches from the way I plan to stick. But before I do that, I'll go ahead and open my my lab draw kit that has my butterfly needle and the Vacutainer. Okay. All right. Okay, there you go. Okay, once I open that up, okay, I just put it close to me. Let's put it close to me, so I'll be ready. Okay. So I have that there. Then I'm gonna go ahead and put the tourniquet on. 2 to 4 inches from where I plan to. Okay. All right. So I have the tourniquet on. Okay. Make sure that I leave a little belt here so that when I'm ready, I will just pull. Okay. I'm going to clean. I'm going to go like 2 to 4 inches below where I tied the tourniquet. Okay. Then I'm going to clean in a concentric motion outside from inside to outside in a circular motion. I don't want to rub. Okay, that way we don't introduce microorganisms around the site. Okay, and then using my left thumb, I'm just going to kind of stabilize the vein that I want. Okay, and then I'm going to go in a circular motion like that from inside out. Okay, okay, now let it dry a little bit. Okay, now I do have my Vacutainer and my needle, So now what I'm gonna do is I'm just going to use my thumb here to release the covering here to expose the needle. Okay, now it's out. Now look at the needle. The needle has both sides, so we want to make sure that we bevel up, because that's how we're able to scoop the needle. So this place goes up, we bevel up, because we want to scoop the we want the blood to flow easily. So we make sure that the needle is beveled up. We don't go this way. That's the wrong way to go. So you go this way so that the needle bevels up. Okay, then use your left thumb to stabilize the vein. Okay, now I'm just gonna stick, and then make sure you tell the patient. Okay, now I'm gonna stick. You're gonna feel a needle stick. Okay, so just take a deep breath for me. Okay, now I'm gonna stick. Now once I see a blood return, like I've seen here, seen a blood return, I'm gonna go ahead and put my blood draw in there. Okay, now I have blood coming. Okay, now I have flash, I take that out. If I need more tubes, sometimes it's good to just kind of wave it around, that way it doesn't get clotted. Okay, if I'm getting more tubes, I'll just put them until I'm done. So once I get that, I'll go ahead and release the tourniquet. Okay, once I release the tourniquet, then I'll hold on to this. I'll go ahead and open this alcohol swab, and then I'm just gonna place it on there, and then I'm gonna pull the needle like downward. Okay, now the needle is pulled, and then I'm just gonna go ahead and push it in. That way it locks, that way you don't get an accidental needle stick. Okay, once that is done, I'll make sure that the side is not bleeding. Okay, and then I'll get you want to hold pressure like a few minutes actually before taking that out. You want to hold pressure for a few maybe like 30 seconds to a minute or something. Once you hold pressure, then you go ahead and take that one off, and then put a 4x4 on there. Okay, and then we'll get a tape or a band-aid if it comes in your packet. Okay, while holding pressure, don't just let it go, because the patient might bleed, especially if they're on blood thinners like Coumadin or something. They will bleed really fast, so you want to make sure that you hold on to that, and then you just place a tape over it. Okay, also check for tape allergy. Make sure if the patient is allergic to this kind of tapes, you might use paper tape or something for their skin. Okay, and then you place it in there, and once you place it in there, you will gather your supplies. You return the patient's arm to a comfortable position. Now there's another important step that we will be doing, and that's we have to label the lab container, because we don't want to label it outside, because we just want to make sure. I didn't get enough tape, but get a tape that is kind of longer than that. Let's see. Okay, put that up in there. Okay, so that it stays in there. Okay, so now what I'm going to do is I'm going to remove my dominant hand. That way I can label the blood sample bottle before I send to the lab. Okay, so I'm going to touch in the middle here to get this glove off. Now I have my dominant hand. Okay, I get my pen, and then I hold on to this. Then I'll have to write the patient's name, Jane Davis, today's date. I write October the 9th, 15, room number 231. I will initial. Okay, and once that is labeled, I keep that there, put my pen back, then I'll grab this right here, because this has to go into shop's container. You cannot put this in the regular trash. Please do not do that. This has to go in the shop's container, so that the housekeepers or whoever it's involved in care in the hospital doesn't get a needle stick. So we take this, okay, and we just open our shop's container and we dump it in there. Okay, Okay, dump it in there. Please make sure you don't put your hand in there, because sometimes you might have some needles, things that are sticking out. So just be very careful and you just put it in there. Okay, then that's in the shops. Now what I do is usually we'll have a biohazard bag that comes with it, where we will put the blood sample in. Okay, so we'll go ahead and put it in the biohazard bag where it goes. Then I'll go ahead and remove my glove, put my hand in here, and just kind of take my gloves off and dump that in there. Okay, then patient is returned to a comfortable position. Okay, then put on my supplies bag. I do not have a biohazard bag to show you, but it's something like this. Something like this that has two pockets. One pocket is where we put the lab slips. We'll put it in there if your hospital has one, and then the inside is where we put the blood sample. Okay, once we put it in there, in that bag, is ready to go to the lab. Okay, then before I leave, I'm going to wash my hand. I'll wash my hand again. Okay, wash my hand thoroughly. Okay. Okay. Wash my hand thoroughly. Make sure I dry well. And then make sure I return the patient to comfortable position if they were, because I raised their bed up. You know, I was pretending to use this as the bed, because to get them at the height that I needed. Okay, make sure I return their arm. Then I'll get their bed back to low position so they don't fall. And then I ask them if they need anything. Are they feeling okay? They say yes or no. They need ice water or anything if that's not contraindicated. And after that, I will leave the room and I'll send my blood sample in the biohazard back to the lab. And that's pretty much how we do venipuncture. Okay, thank you for watching this video.